Hello, my name is Tim Redding and I am a graduate student at Morningside College. I'm currently a teacher at the Middle School Alternative Center, referred to as MAC, for Des Moines Public Schools. I currently have a K through 6 elementary education endorsement, a K through 8 social studies endorsement, and a K through 12 BDLD endorsement. The name of my study is The Effects of an Online Math Program on Students with Emotional and Behavior Disorders. Students with emotional and behavior disorders struggle in many areas of academics, entering high school over 3 years behind their same age peers. Students with emotional and behavior disorders show a large deficiency in their math achievement, with scores rarely increasing and often decreasing over time. Two problems students with emotional and behavior disorders face when working in mathematics are a lack of prerequisite skills needed to solve problems and a lack of motivation to complete problems. This can have an impact on teaching, with many disruptions in the classroom as well as students being removed. It can have an impact on the students, with being over 3 years behind their same age peers. This can have a profound effect on their ability to graduate, which then turns into long-term effects, such as being arrested and not being able to graduate college. Why did I choose this topic? I currently teach in a ninth grade math classroom with students who do not have the prerequisite skills to complete higher level math, such as Algebra 1. They struggle with simple multiplication, simple division. These students need an intervention to help them get back on grade level and on the same plane as their peers. So what are emotional and behavior disorders? It's the inability to build or maintain satisfactory interpersonal relationships with peers or teachers, the inability to learn, which cannot be adequately explained by intellectual, sensory, or health factors, or chronic, inappropriate type of behavior or feelings under normal conditions. Going back, I looked at 3 different forms of instruction. The first being small group instruction. It's a past intervention that has been used frequently with students with emotional and behavior disorders. It has been discussed as an alternative instructional strategy for students with emotional and behavior disorders in hopes of boosting academic achievement. In the study I looked at, students in a self-contained classroom were observed during instructional time for 15 minutes on 4 separate occasions, focusing on behavior and academics. Upon completion of the study, it was noted that small group instruction, there were benefits academically as well as behaviorally. However, it was also noted in the study that SGI alone will not close the academic gap that emotional and behavior disorder students possess. The second instruction type that I looked at was direct teacher instruction. This instruction is utilized by means of presentation or talk to a group of students. This type of instruction is clear and concise, allowing structure and repeated review of subject material. The study I looked at, it compared direct instruction, computer instruction, and a combination of the two. It consisted of 10 9th through 11th grade students in a self-contained classroom. Students benefited from various types of instruction, but no one form of instruction increased academics for all participants. And finally, the last one I looked at was online learning. The use of technology in the classroom is becoming more acceptable as teachers are looking for ways to engage students in the classroom. Using technology has been shown to increase student learning by increasing their attitudes. Students participated in a study to see the benefits of using an interactive online learning model for a physics class. The study had 17 participants, with 9 being the experimental group. At the end of the study, it was shown that the experimental group achieved at a much higher level on the final exam. So what were our gaps? So for small group instruction, students were not focused on math, and SGI alone will not close the learning gap that EBD students possess. Direct teacher instruction, the online learning program was not interactive. There was no conclusive results. And finally, online learning, it didn't focus on emotional and behavior disorder students, and students were not focused on math. So the overall gap is research is needed on how an interactive online learning program focused on math helps emotional and behavior disorder students. So our research question is, does using an interactive online math program improve the math scores of emotional and behavior disorder students? The purpose of the study was to determine if implementing an online math program would boost emotional and behavior disorder students' math achievement. It could have a couple side effects as well. There could be decreased classroom referrals and behaviors, increased classroom engagement, and an increase in assessment scores. It was hypothesized that the implementation of an ALEKS interactive math program will increase post-assessment math scores for students with emotional and behavior disorders. The results of the study could be used to assist teachers in making instructional decisions for students with behaviors. Emotional and behavior disorder students need interventions that will help them close the gap, the academic gap that exists for them to get back on grade level. An experimental A/B design with a pre-test, midpoint test, and a post-test was used. There were 12 participants that were in 9th grade. All were male, ages 14 through 15. All the students were in special education, with all 12 having 2 behavior goals as well as a math goal. 1 student was Hispanic, 5 students were Caucasian, and 6 students were African American. All students that participated in this study were placed in an alternative high school setting structured for behaviors. The data that was collected, the participants were assessed and measured on an Algebra Foundations Competencies Placement Assessment. It was created through collaboration between teachers and the head of the math department for the school district. It was given as a pre-test, a midpoint test, and a post-test. During one phase of the study, the small group instruction phase, math by topic, level D was the curriculum used. The ALEKS program, participants were enrolled in the RTI 6 ALEKS course. So this study was a 12-week study that took place during the fall of 2018-2019 school year. Students first had a pretest. They then had 6 weeks of small group instruction focusing on lower level math concepts. They then had a midpoint test. After the midpoint test, the students then had 6 weeks of using the ALEKS interactive online program, in which they were assessed and then given topics to work on daily. At the end of the 6 weeks, students were then given a post-test. After completing the ALEKS intervention, all of the math scores for each participant were compiled and analyzed. Each participant's pre-assessment, midpoint assessment, and post-assessment scores were compared using a dependent samples t-test. The 2 phases were compared based on their pre- and post-test scores. Statistical data will then be derived from the dependent t-test. Results. Results from Phase 1 pre to midpoint test indicate that student scores increased at a significant rate, with a low probability of the results being due to chance. Results from the second phase indicate that student scores also increased at a significant rate, with a low probability of results being due to chance. Both t-scores were higher than the standard value that researchers use of 2 or -2. We can conclude that both scores the researcher obtained were significant, and we can exclude the chance with low p-values of greater than 0.05. There are two tables of the information that I was just giving you. Overall findings showed that both forms of instruction increased student math scores at a significant rate. However, with both scores being so high, we cannot conclude that ALEKS is more effective than traditional small group instruction. Therefore, the hypothesis that ALEKS will increase students' math scores as compared to small group instruction was not supported. Past research and theory. The cognitive theory of multimedia learning. This theory states for learning to happen, information can be received both visually and auditorily, with a combination of the two being best. It was very evident in the utilization of the ALEKS program. The ALEKS program allows students frequent opportunities to interact with materials both visually and through audio. Students can look at explanations that have writing that they can look at, as well as videos that show both in action. Small group instruction. Increased scores during the small group instruction phase can be traced to a few factors. Participants were able to work in small groups, limiting distractions. Participants were able to have increased time with the teacher, and small groups allowed the teacher to tailor lessons to meet the needs of that group of students. What did I learn? The results of the study did not support the hypothesis. However, a lot was learned. There were less distractions in the classroom, less frustrations from students. It limited student-to-student interaction. Teachers are allowed to focus on academics rather than behavior. Teacher can see real-time progress via the ALEKS program. And it allows students to make up skill deficits that can hinder future prospects, such as graduation. It could have profound effects. What were my limitations? My sample size, I only had 12 participants. It was limited to all males with emotional and behavior disorders. The study was short, only 12 weeks long. There was a lot of lost time spent adjusting. Not a lot, but there was some time spent adjusting to the ALEKS program. There was a lot of cell phone distractions in the classroom, as well as a small incentive program that could be much larger. Suggestions for past research: larger class sizes, both male and female students with emotional and behavior disorders being utilized, and extended time on the study, as well as decreased distractions. Here are my references. Thank you.